بسم الله الرحمن الرحيم. الحمد لله رب العالمين والصلاة والسلام على أشرف الأنبياء والمرسلين نبينا محمد وعلى آله وصحبه أجمعين. Good evening, everybody. On behalf of the board member of the Saudi Society of Pediatric Gastroenterology, Hepatology and Nutrition, would like to welcome you to our scientific activity of the SASPIGAN. SASPIGAN is abbreviation of the Saudi Society of Pediatric Gastroenterology, Hepatology and Nutrition. Tonight we have our infant nutrition series that will start first one tonight. It is my pleasure to introduce Dr. Almuhaidib. He's the consultant of pediatric gastroenterology, hepatology and nutrition at King Faisal Specialist Hospital. Dr. Almuhaidib is the head section of the pediatric gastroenterology at King Faisal Specialist Hospital at Riyadh, and also he's the founder of the pediatric gastroenterology fellowship program in Saudi Arabia. Dr. Almuhaidib, he's a board member of the SASPIGAN, and also he's the head of the development and scientific committee at SASPIGAN, who will be the moderating the session. Now, welcome, Dr. Ali.
Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you, Dr. Muath, for this nice introduction, and it is our pleasure to start, the first webinar of this infant nutrition webinar. It will be a 4 webinar series, 2 in this month and 2 in the next month. And also in the society, we have prepared an interesting program where we will have a single topic webinars every month, starting from the month of June, July, August, and September, as well as we have introduced a new activity called, Pediatric Endoscopy Video Forum, which will take place maybe end of July or first week of August. In addition, it's a good chance to announce about the SASPIGAN International Conference, which will take place on 21 to 23 of October 2021, and everybody is invited to attend to these activities. Today, as Dr. Muath mentioned, we will start our infant nutrition series webinar. It is my pleasure to introduce Dr. Muath, who needs no introduction. He is a consultant pediatric gastroenterologist at King Salman Hospital, and he is the ex-chairman of the Department of Pediatric at King Salman Hospital. He has a long experience as a Secretary General of the Saudi Pediatric Association, and also he was the chairman for the SASPIGAN in the third board, and now he is the current president of the SASPIGAN. He is very active in scientific activities and involvement in education, and today it's our pleasure to have him talking about the role of breast milk in immunity and gut health. Dr. Muath, please.
Thank you, Dr. Ali. I would like to thank Dr. Ali for this introduction. I would like to thank the Nutrition Company also for their scientific support for the SASPIGAN. It is our, vision and mission that to improve the education in Saudi Arabia, in our society, and we have in collaboration with such companies to support the scientific programs and activities in our community. Tonight we'll start about the infant nutrition series. The first one, which is very important, is the breast milk. What about the immunity of the breast milk, and what about the role of biotics or family? As we know that breast milk is very important, we have to encourage that one, to support that one. We have to highlight about the breast milk composition and what are the biotic families and what's the importance of the gut role for that one. As everybody knows that breast milk is a complex fluid and is most important the first 6 months of life. It's very important nutrition component. as we know that recommended by all the institutes, either the WHO or the SPGAN or NASPGAN. Also, we are in SASPGAN recommend and support encouraging the breastfeeding in our society. As you know, that breast milk contains a large amount of immunocomponents, especially lactobacilli, white blood cells and other components, different vitamins, different immune components of the improve the immune system of the infant. This is some pictures about breast milk, and about the cow's milk is for the cows, as you know, and the elephants for the elephant, and giraffe for the giraffe, and horse milk for the horse. So we have to encourage breast milk in our society. What about breast milk in Saudi Arabia? We are actually having low incidence of breast milk in Saudi Arabia, unfortunately. We're talking about either partially breast milk or exclusive breast milk. One of the papers published by our one of our colleague, Professor Ben Ali at Asir region in 2012, that they studied the teachers at intermediate school, and they found up to only 8% almost they have exclusive breastfeeding in the first 4 or 6 months life. Other paper regarding breast milk in Saudi Arabia, why mothers are not exclusive breast milk, and this is done at the chair of breastfeeding and also King Khalid First Hospital and published in the Sudanese journal, and they found that there is a lower level of breastfeeding knowledge, and especially in the working mothers. And also there is a lack of insufficient information regarding the benefit of breast milk during the antenatal classes, which is very important. Other paper regarding they comparing the different region of Saudi Arabia. They compared the central region, Riyadh, northern and Hayel, and Dammam, the eastern region, western region, and the south, Jazan. And they studied the early initiation of breastfeeding in the Kingdom of Saudi Arabia. As you know, that we know that later on, that importance now of the early initiation of the breastfeeding, and they found that there is infant mothers who give birth by certain section, they are delayed in that one. The education level that affect the early initiation of that one, and also those mothers who do not have any information. This is important. They have to have classes during antenatal follow-up, and also they don't have about the time. What's the best time to initiate the breastfeeding? Even the WHO, the Eastern Mediterranean Regional Office in the WHO, they also studied the Middle East, North Africa countries. As you know, it was so high exclusive breastfeeding in those countries, but unfortunately, with the, we can say the ladies become more, working, and they couldn't have time to give breast milk, and become more industrial countries, and moving from rural to industrial countries, they become now decrease the incidence of or prevalence of the breastfeeding in those countries, either Lebanon, Yemen, Pakistan, Jordan, and Iran, and where they have high incidence of breastfeeding. About the Gulf region, in the Gulf region, they have high breastfeeding rate and low breastfeeding rate. They compare between the mother's age, the working mother, the rural residency, or they were in the big cities, and the multiparity. They found high breast in rural area and multiparity, and they are not using contraceptive. They have increased maternal age. They have high incidence, high breastfeeding rate, while those mothers who are workers and who's in industrial region, or they have using contraceptives, or young mothers, they don't like to give more breastfeeding, and they have low incidence of breastfeeding. Okay, can we have the first poll, please? The first question now for the audience, for the attendees. We have some questions. Okay, as compared to infant milk formula, human milk is higher in what? Fluoride, zinc, cholesterol, or calcium? We have 1 minute to have an answer. Okay, can we have the answer? As compared to infant milk, human milk is higher in what? Well, actually, they have high in cholesterol compared to the infant formula. It's okay. About types of breast milk, as you know, we have the colostrum, which is the first stage of breast milk produced after birth. It is last for several days, and yellowish color, high protein, especially antibodies, vitamins, minerals, but very low in fat compared to mature breast milk. The mature breast milk has more fat, as we mentioned. This transitional milk, this is after the first 2 weeks of life, and usually they have high level of lactose, fat, and water, soluble vitamins. And the mature one have lactose and 90% water, and also they have carbohydrate, proteins, fat, and also fat soluble vitamins as well. The mature milk. Can we have the second bolt, please? Second question, please. Breast milk contains more of the following than cow milk: either lactoalbumin, calcium, iron, and folic acid. Which one of those has high in the breast milk compared to the cow's milk? A, B, C, or D? Can we have the answer? The answers? Excellent. Okay. As you mentioned, lactoalbumin is quite high in the breast milk compared to other minerals and vitamins. Okay. This is the comparison of 100 ml of colostrum with the mature milk. We'll find that they have more, lactoalbumin and secretory IgA as well, and lactoferrin. So those are immunocomponents which are high in the colostrum. If the milk, the first milk contains water and vitamin protein, and the hind milk contains more heavy in lipids and carbohydrate. This milk is the most effective dietary intervention, as I mentioned. It decreases the risk of atopy. Can we have the third pause, please? A breastfed infant is expected to have lower incidence of which of the following common childhood condition? Asthma, rhinitis, impetigo, or diarrhea? Asthma, rhinitis, impetigo, or diarrhea. The breastfed infant is expected to have lower incidence of which of them of the following? So I have the answer, please. Okay, good. Diarrhea is more because the infants, they expect to have diarrhea. Then after that, maybe asthma. Okay, what are the major nutrition components of the breast milk? We now have the macronutrients, protein, carbohydrate, and lipids. The protein, either whey protein or casein, and the carbohydrates, either lactose or oligosaccharides, and lipids, triglycerides, phospholipids, sphingolipids, steroid, and fatty acid. There's another slide that show how the components composition of the breast milk. Lactose is mainly one. Fat was important for energy and the brain and immunity. Also the prebiotics, which are about 12 grams per liter, which is important the microbiota and the immunity and the gut health by prebiotics. Protein is important for growth and immunity as well. Lactose for energy, and we have long-chain and saturated fatty acid and others. Breast milk, as we mentioned initially, it is complicated, complex components. You know, antimicrobial factors, hormones, cytokines, digestive enzyme, transporters, growth factors. You know, every time, you know, we discover new components in the breast milk, and this is why, you know, trying to mimicking the breast milk components. As you know, for 20 years back, they discovered the long-chain polyunsaturated fatty acid, LC-BOFA. Then after that, they found different type of DHA and so on. Then now prebiotics and what kind of biotics, what are the biotics, what are, you know, those every time that we have new things in that one. And we have the pause number 4, please. Compared with bottle feeding, breastfeed is relatively protective against what? Late hemorrhagic disease of the newborn, maternal breast cancer, late onset diabetes, or prolonged jaundice. Compared with the bottle feeding, breastfeeding is relatively protective against what? Late hemorrhagic disease of the newborn, maternal breast cancer, late onset diabetes, or prolonged jaundice. Okay, good. Late hemorrhagic disease of newborn, we know that the breast milk does not contain vitamin K. And this is why we are giving vitamin K for any newborn, you know, that we have to give him 1 milligram intramuscular. And this is what if we have, home deliveries who were not given vitamin K, they prone to have hemorrhagic disease of the newborn. And late onset diabetes is not, protective against that one because late onset. And prolonged jaundice, no, we know that breast milk can cause jaundice. So the maternal breast cancer is the one is important that the breastfeeding will protect, inshallah, against maternal breast cancer based on the evidence-based medicine and the studies that they have shown. Okay. Breastfeeding reduce infant risk, for major infectious disease and inflammatory disease such as upper or lower tract infection, acute gastroenteritis, otitis media, neck, diabetes, type 1, sudden infant syndrome, atopic dermatitis, asthma, and this is based on evidence-based medicine that breast milk can prevent that one. What about prebiotic in the human milk? Oligosaccharide in human milk promote growth of lactobacilli with the bacteria in infant large bowel. They produce acid by their bacteria, and those they important the growth of potential pathogen like E. coli, Salmonella, Shigella. They will inhibit the growth of those organism or those bacteria, because the acidic environment will enhance the buffering capacity of the human milk. Oligosaccharide, as we mentioned, it is 10 to 12 grams per liter, and usually they protect against attachment to invasion pathogen. And oligosaccharides is not found in the cows, only in the breast milk, in the human milk. What about the first 1,000 days? Now they talk about 1,000 days important. 1,000 days means the day of pregnancy plus the first 2 years of life. So 1,000 days is important as for the infant since he's since pregnancy. If we consider the 730 days of 2 years and 270 days of the pregnancy, that 1,000 days is very important for the neonate. They found even they have long-term studies regarding the importance of the first 1,000 days. What's the mother exposure? What's the mother nutrition? What's the mother factors, risk factor? How's that impact on their infant? Their newborn and infant and so on. With the first 2 years of life, even they studied about the risk of the diabetes, heart disease, coronary heart disease, and so on. This is why they concentrate on the first 1,000 days, which how it's very important, to concentrate in the nutrition and to take care and to prevent and protect the first 1,000 days, either during the pregnancy or first 2 years of life. So, what the meaning of dysbiosis? Dysbiosis means that imbalance of function and of this pathogen or bacteria, and especially if the mother have cesarean section, if the baby cesarean section is not vaginally born and not exposed to these pathogens that like bifidobacteria, those that colonization will increase the microbiota, so those cause dysbiosis. So those who's born as cesarean section have high risk compared to vaginally delivery. So because the colonization is important in giving more bacteria, which is not the harmful but the useful bacteria for the newborn. And also, as we know, unfortunately we are using antibiotics, especially in the NICU, and if we give more antibiotics, that will kill the good or useful bacteria in the gut of our newborns. Or sometimes if the baby is admitted, also they will have acquired infection. And we have number 5, pause please. What is the largest immune organ in our bodies? Lymph node, brain, muscles, or gut? The largest immune organ in our bodies. What is the largest immune organ in our bodies? Lymph node, brain, muscle, or gut? Can we get the result? Can we get the result, please? Lymph node, brain. No, actually, it's the gut. The gut is the largest immune organ in our bodies. Okay, gut is the largest endocrine organ, highest concentration in cells, 70% total immune cells through the complicated or complex neural network. There are trillions of bacteria, fungi, or viruses. Actually, the immune system continues to develop after birth. This development of fundamental infant from the infant or the newborn he was in his uterus, mother's uterus, protected by the environment. And also there is maternal immune system that protects that newborn. And during pregnancy, he's protected. And there is what we call it resilient immune system, the transition between when he was born, till he get his own immune, system or antibodies to grow. As you know, the first few months of life, he's depend on his mother IgG, for example. So this is important issue to understand that. And also, as you know, the gut surface area almost 30 meters square in adult and hosts about 70 to 80% of the human body immune cells. So this is importance of the gut as center of the immune system, because also gut barrier is part of the first line of defense against pathogens and mediate immune response. Okay. And also it contains 100 trillion bacteria, as we mentioned, which are essential development of resilient immune system, what we call it. So this is different kind of immune components like gut-associated lymphoid tissue or the secretory or IgA. Those are very important immune components that defends the body of the newborn. And this is other slide to show how is the gut or immune system is mediated by the gut brain, and it is complex mechanism, but this is how it affect the infant immunity as well. So it's the importance of early life nutrition, early breastfeeding, the early to introduce or to give our newborn the breast milk, because breast milk contains high amount of immune components, as we mentioned earlier, those who missed the first presentation. And it's important also the first 1,000 days of life of our infants that will affect them. So, and first, the human milk, as we mentioned, that develop will affect the gut microbiota and the immune system, and because there are many bioactive components, as we mentioned, the oligosaccharides, low-level bacteria, as we mentioned, the streptococci, lactobacilli, and bifidobacteria, and this is what we mentioned, that importance of breast milk, that to start the first 6 months of life as exclusive breastfeeding, as it contains large amount of human component like lactoalbumin, secretory IgA, and prebiotic, and different oligosaccharides will work as protecting our bodies, and will enhance more microbiota that important in our body, that will help in preventing, inshallah, in the premature babies to have what we call necrotizing enterocolitis, or decrease, inshallah, the infection, or decrease atopic dermatitis, or decrease the functional GI disorders such as diarrhea, vomiting, regurgitation. Those, breast milk components will help to increase the immune system. One of those found, as we mentioned, the oligosaccharide and the prebiotic and the probiotics, and all these biotics family have a strong role in they discovered it in the breast milk, have strong role in protecting and enhancing the immune system of the body of the our infant, especially in the gut. And they found that human milk has almost 100 cell per ml of bacteria, that good bacteria, as we call that one, and they have metabolites like in the cell wall compounds, and they are stimulate healthy gut microbiota, as we mentioned, and immune function and gut development. So this is why the importance of the breast milk component. What are the biotics? Biotics in general, it is a Greek word, biotikos, meaning pertaining to life. Essentially refer to biological ecosystem. They are compromising living organism with their physical environment. There are different type of biotics. Okay, as you see here, probiotics, prebiotics, probiotics, symbiotics, and postbiotics. This is now the talk about postbiotic and symbiotics. We know that pre and probiotics since long time. There is awareness, as we know, about healthcare providers regarding the benefit of prebiotics and probiotics. And now we talk about symbiotics, which is our, if we combine them, combination used as symbiotics. The latest member of biotics family are postbiotics, refer to bioactive components of compound produced during the fermentation process that may confer health to the host. So what about prebiotics? As we know, the well-known prebiotics and the most important, as by ISAB, the International Scientific Probiotics and Prebiotics Association. We have, as you know, the long chain, and the short chain. They found in the breast milk, they came with this ratio, 9:1. Short chain fatty acid and long chain fatty acid, 9:1, the GOS and the FOS. They trying now mimicking the breast milk, and by making the same mixture of 9:1, 9 of short chain short chain fatty acid, and 1 is long chain fatty acid. They are trying to mimic that one, and this is the mechanism of prebiotics. You know, the prebiotics, the GOS and FOS, the 9:1 ratio, they have selective fermentation, and the T helper 1 and interleukin 10, they comes to the gut, the short chain fatty acid, acetate, bitrate, to go to the large bowel. They will increase, the immunity by increasing the natural killer activity and phagocytic activity. This will have defense against pathogens, and this will reduction in infection as well. So this is the simple mechanism of the prebiotics. This is the same thing, explanation of those prebiotics, like with the bacteria and lactobacilli, how they metabolize, and prebiotics as oligosaccharide mixture of 9:1, how they affect as short chain fatty acid and lowering the pH in the small bowel, and the result that will increase the more immunity and decrease the infection as well. And this is the same thing, that modulation of the gut microbiota. They has shown that stimulate the growth and activity of the benefit bacteria, and they also trying to make some components of the short gut and the short chain, long chain, 9:1. They trying to mimicking the breast milk, and how that affect in decreasing infection, and also decreasing the stool, hard stool, to make it softening stool, to decrease colic and crying incidence of the infants, because they're suffering from what we call it the functional GI disorder. So this is the benefit of short chain GOS and FOS ratio, and to increase the bifidobacteria, decrease the infection. And there are many studies. All this coming slide now regarding studies. They have some different papers, actually, different studies, randomized, controlled studies to compare the regular formula compared to formula contains long chain and short chain fatty acid with the same ratio of the breast milk. And they found if they add the same ratio of breast milk, that will have some result, that good result, that will have some decrease incidence of infection, atopic dermatitis. Mimicking breast milk, of course, it will not be like breast milk. This is different paper, different study. All of those, studies mimicking trying to mimicking the breast milk in the special ratio of 9:1 between the GOS and FOS, and decrease atopic dermatitis, decreasing the infection, decreasing the diarrhea, softening the stool, as hard stool as we are seeing in our practice, crying infantile colic, constipation, even in the first month of life, first 3 months of life, even his breast milk, sometimes they have that one, and they trying to found to help, in adding this GOS-FOS ratio, and those lysozymes and secretory IgA to help the immunity and to decrease also the hard stool in the infant. Same thing, if they improve that one, they will improve the gut motility as well. And if the gut improve motility, also the gastric emptying will increase. That will decrease the incidence of constipation and no more crying or fussiness of our infants. There is different paper. This is on fixing the first 6 months of life, more than 260 patients, and other paper regarding comparing the hard stool. All those they found if they added same breast milk, they will have a same result of that one, or near to breast milk as a control, and even the fecal microbiology, they will measure the stool, how much microbiota and the stool of the breast milk compared to infant who's giving formula containing 9:1 GOS and FOS ratio compared to regular formula without GOS and FOS. Can we have please maybe the last pulse, please? What are the most benefits of prebiotic on the infant's GI system? Improve gut motility, decrease gastric emptying, stool become more hard, worsening the feeding intolerance. What are the most, or what is the most, what is the most benefit, or what are the most benefits, if there is more than one answer, no problem, of prebiotics on the infant's GI system? Improve gut motility, decrease gastric emptying, stool become more hard, or worsen the feeding intolerance. Excellent, thank you very much. It is improve gut motility. It will not decrease the gastric emptying, actually increase the gastric emptying. If we increase the motility, the gastric emptying will improve. Same thing, the stool not become more hard. Why we get hard stool in our bodies or in infant, or we have things seeing our patient? Because delayed gastric emptying and the decreased motility, that will make stool more hard. And this worsening, no. If the breast milk contains prebiotics, this will improve the feeding intolerance. So the most thing that improve gut motility, increase gastric emptying, and the stool become more soft, and the feeding intolerance will improve, inshallah, if we encourage breast milk, and if we also sometimes giving the sunfos. What about probiotics? Probiotics are live microorganisms when given an amount that have benefit for the host. There are numerous organisms have been researched in infant, even the preterm as well. They gave different or various doses for that one. The probiotic products produced by they may contain one or more bacteria strains. The two most frequent two studies our strain bacteria, the Bifidobacterium and the Lactobacilli genera. They should be well characterized, and they should be also studied more. And because probiotics difficult because it's live organism. One of the advantage that normalize the gut microbiota. This is the advantage of probiotics. They might inhibit the pathogen like Bifidobacterium lactis, BB12, and Lactobacillus GG. They have shown effective inhibit colonization by pathogenic bacteria, like in the Clostridium or Campylobacter and Salmonella and E. coli. This is the probiotics, but we are not adding or giving probiotics like in probiotics. They found certain probiotics. They have a significant role in preventing GI conditions, as we mentioned. there is anti-effective benefit of probiotics, as you know. I mean, the probiotics have some benefits, but not having studies large like prebiotics. They have also regulation in the gut motility as prebiotic, as we mentioned in the previous slides. Based on that, even though we improve the colic symptoms in some studies, immune modulating, all those, as we mentioned, studies regarding comparing the breast milk and the formula that contains probiotics. Same thing for allergic, for atopic dermatitis as well. And if we have prebiotics and probiotics, what we have, that we have symbiotics. The mixture of pro and prebiotic, they're effective in the host. They prolong survival, I mean, of the gut, and more the host will have more, I mean, healthy host. There is how that can, because there is stimulation of the colonization by probiotics, which activate or stimulate more prebiotic, stimulate more microbiota. This is why I think why to have symbiotics together, pre and pro, and that will have symbiotic will increase more in the gut, more healthy gut, and more, I mean, high immunity for the gut as well. What's the benefits and use of symbiotics? They found that symbiotic, some clinical data in some formula will have some, I mean, benefit increasing the microbiota, and the host will improve, and also compare the cesarean section with the normal delivery. In cesarean section, they have less, I mean, benefit if compared to vaginally delivered infants. Also, they found immune function and allergy will be improved if they have, I mean, symbiotics compared to, I mean, better to, like they thinking that better to have symbiotic, that because decrease incidence of labor rash, and also decrease, I mean, the diarrhea and atopic dermatitis. But postbiotics, postbiotics, they are bioactive compounds produced during fermentation process. It is something now they start to study that one. They do fermentation for that one, and they by fermentation they will have postbiotic, which can be from the cell wall, from I mean, vitamins, lipids, and trying to make fermentation to have this postbiotic. Maybe this would be much better, much high immunity, and more gut microbiota, more, I mean, preventing pathogens, and still there is studies, still there is under, I mean, there is some paper that evidence-based medicine support that one, but still needs more study and more supportive, I mean, studies and randomized controlled studies for that one. Also, they found that they have, I mean, antioxidant, and also they found that postbiotic have some rules also in what we call it hypertensive, or also still new things that they found postbiotic, maybe some have new rules compared to the prebiotics or to other oligosaccharides. And still, you know, if we see the slide, bacteria and the lipids, and still all these can be, I mean, postbiotics. This is what we mentioned, how if they do fermentation, how that in the infant formula, how that can to help in improving the immunity, improving the gut, and how that's going to be done. And this is done in Europe for, I mean, years back, and they have some papers, some controlled studies showed that postbiotic, it might have some role in improving, I mean, the gut immunity and health of the infant. This is regarding in general the prebiotic, probiotic, symbiotic, and postbiotic, and all of these issues, all of these components it has been found in breast milk. The gift of our God that we have to encourage and to support breast milk in our societies, in our environment, in our families, to encourage them, especially when they start to be pregnant. We have to give them classes to prepare them to have to be ready for breast milk. As you see, a lot of components discovered in the breast milk, trying to mimicking that one, trying to add that to infant formula. Still, we have something gift from God, free and ready and healthy that we have to support. This is also, I mean, regarding postbiotic, the fermentation of that one, how that improve the digestive, how is that improve, decrease the colic and bloating, as we mentioned. Even the neck, it might have some role in the neck in the premature infant. They have also combination of probiotic, postbiotic, and infant formula. They're trying to also add all of these components, and they studied their impact on the immune system and in the infection and in the allergy as well. Or are they going to decrease the allergy? They found yes, some supportive studies, which, as mentioned initially, I mean, found in our breast milk and human milk. This is, I mean, other papers regarding the GOS and FOS and also postbiotic and fermentation. How's that going to improve the, I mean, gut and the immunity of our infant? So many paper, many studies that support that one, how the higher level of acetic acid, secretory IgA, increased bifidobacteria. That's what we discovered from the breast milk, and now we're trying to mimicking that one, and they found that infant formula contains that one. It might have same thing in breast milk. So this is what we discover now. What we'll discover in the new decade, in coming decade, maybe the genetics issues in the breast milk. Maybe we'll discover new components in our breast milk, because still under investigation and under study of the breast milk that we discover a new thing in our breast milk, a gift from God and our God. And أنا دائما أقول هدية من الله. We have to support breast milk. Okay, in summary, what are the GOS and FOS? How are they important? They are oligosaccharide, prebiotics. GOS is short chain, while the FOS are long chain. The GOS and FOS in 9:1 ratio on some infant formulas might mimic the function and size distribution of non-digestible oligosaccharide in human milk, with many benefits of the infant, as we mentioned. What is the largest immune organ in our bodies? As we mentioned, the gut. The gut is the largest immune system because it contains around 100 trillion bacteria, which is essential for the development of flexible immune system. What are the most benefits of prebiotic on the infant GI system? As we mentioned, the prebiotic, when added to the infant formula, it might improve the gut motility, gastric emptying, and softening the hard stool, will improve feeding tolerance, mimicking the breast milk, as we mentioned. What is the role of probiotics in the microbiota? The probiotics has ability to normalize the gut microbiota by multiplying and colonizing the intestinal tract of the host, and helping and ensuring the proper balance between the pathogen and commensal bacteria. And this is the, I mean, balance of the, I mean, colonizing bacteria in the gut. As found the breastfeed. The postbiotic are bioactive compounds produced during the fermentation process. Those might be organic acid, microbial cell wall components, proteins, lipids, carbohydrate, vitamins, other complex molecules. Those are the postbiotics. What's the benefit of adding postbiotic and prebiotic? This is what we mentioned in the previous slide. There are some study they found it have some impact in the immune system through the gut and microbiota. Why we have to encourage the early initiation of breastfeeding for the normal newborn. This is what we mentioned in the initial slides. Now, as you know, in the delivery room, when the mother gives the baby, you have to give the baby to the mother to put her newborn in her lap. Why? Very important issue. They found this important issue. This will increase the duration of breastfeeding, will provide colostrum as the baby's first immunization. This will take advantage of the first hour of alertness. Babies learn to suck more effectively improve developmental outcome, allow skin-to-skin contact. This make warm and colonization of baby with maternal organism. This is the steps that we have to do. This is what we have to encourage. What we call it the hospital-friendly, hospital baby-friendly hospitals. This we have now. We are encouraging that one. We are putting that one to encourage the breastfeeding. Even the mother refused. So we have to prepare her during the antenatal care. We have to tell her that once you get your baby, will give your baby in the first half an hour of life. You have to keep it in your lap. You have to give him your feeding the first half an hour. This is the studies, if you remember in the previous, in the first slide, we from King Khalid University, that they don't know what the time of starting feeding. This is important. We have to encourage, this information to our ladies and the mothers who are going to get pregnant. Why we have to encourage? Keep mother and baby together. Place baby on mother's chest. Let baby start suckling when ready. Do not hurry or interrupt the process. Delay non-urgent medical routine for at least 1 hour. So this is important. This is how we support and encourage, breastfeeding, and encourage the first hour of life, giving breastfeeding to the mother, as we mentioned in the previous slide. Thank you very much.
Thank you, Dr. Muath, for this very heavy and dense, presentation. For the sake of time, we have few questions. Maybe I will start with the first one. You answered the question partially, but why Saudi mothers do not breastfeed? This is one question.
Thank you very much. Good question. Very important question. Many things actually. We are, as a healthcare providers, we need to encourage breastfeeding. We need to give more awareness, even as societies, the Saudi Pediatric for Pediatric Gastroenterology, ASAS began, Saudi Pediatric Association, Breastfeeding Association, the new one, as I am also founder of the Breastfeeding Association. We have to encourage, we have to conduct campaign for the mothers in the hospitals and the universities, in the malls, after inshallah the pandemic of COVID, that we have to increase those things, awareness, even the social media regarding the importance of breast milk, and to initiate that one. Other things also, as a part of, unfortunately, as a physician, just quickly changing the formulas. If we have infant with some sort of regurgitation, vomiting, Allah يسامحهم, some of our colleagues, they quickly change the formula. No, we have to encourage the mother to give breast milk. We have to change the way how to feed. We have to support her, to help her, not just to change the formula or give the formula. And other things, the mothers are afraid from cosmetic issues and so on.
So it is partly also in the healthcare providers is to make sure that they are child advocate and support breastfeeding in all aspects. The second question, for the sake of time, what about breastfeeding in a COVID positive mother?
Yeah, thank you very much. Yeah, we have studied that one. We have in the Breastfeeding Association. There is no problem. There is guidelines, for that one from Ministry of Health, and in collaboration with the scientific committee in the Breastfeeding Association. Alhamdulillah, they can give breastfeeding. For any mother she like to have any information regarding that one, they can communicate our colleague in the Breastfeeding Association in the Twitter, SPFA 2020. They can find the answer. We have already, a booklet for that one.
Okay, thank you very much. Maybe we'll proceed for the second presentation. I hope it will be shorter than.
Yeah, the second. Yeah, sorry, because the second. Let me. It's long, to talk about this issue. Let me just have the second one. Where is it? I have a short case scenario, if you allow. It's very, very nice case scenario, حقيقة. Maybe case scenario is
okay. That's fine. That's fine if you want to proceed.
Yeah, I have case scenario maybe less than 10 minutes if you allow. Very nice. حقيقة. We are facing these cases in our daily practice حقيقة as infants. Okay. Bismillah. Share screen. Okay. Is clear? Clear? Is it okay now?
Yes, yes.
Bismillah. Quick for our pediatricians and our attendees and healthcare providers. 10 weeks old boy present with history of excessive crying for 2 to 3 days. And there was no history of fever, vomiting, diarrhea, or constipation. He's in regular formula, unfortunately. No history of herbal medication, no history of trauma. Crying was almost continuous, not related to food or time. Clinically, in the clinic, he's an infant crying, irritable, but generally looking well, alert, has no dysmorphic features, not pale or jaundice. The anterior fontanelle is soft. His primitive reflexes are within normal. We examined his ears. There is no ear discharge, but sometimes difficult to examine the ear during the crying infant. It looks intact eardrum, and systemic examination was unremarkable. His weight and height, head circumference are within normal. Vitals is okay. Skin, musculoskeletal, chest, abdomen. He has normal male genitalia. What do you think? We have polls. If we have time, can we have polls, please? Quick. Otherwise, we move. The first polls for second presentation. What do you think, our colleague? We are facing usually 10 weeks, crying, coming to the clinic, emergency room, shopping from clinic to clinic.
Is it, an infant colic?
Okay.
Preparing the bones?
Could be potassium media, could be infantile colic, could be constipation, could be urinary tract infection, could be insect bite, isn't it? This is our usual thinking actually.
And sepsis maybe, and meningitis.
And sepsis. Thank you very much, Dr. Ali. Okay. This is the infant crying. What's the next step? What we have to do? Okay, because of the sake of time, I think they are not ready for the polls. If they are ready for the second polls of the second presentation, I will be happy. If not, we'll proceed. Anyway, we'll do urine analysis, maybe. Reassure the mother. Change the formula. Encourage breastfeeding, others. This is the usual scenario in our practice. And some will reassure the mother, some unfortunately will change the formula for no reason, because of crying. I will be happy if we encourage breastfeeding and help the mother. But actually, let us assess the crying. Is the crying continuous or occasions? Is it sudden, related to the food or bowel motion? Are we doing proper physical examination? What we did actually for this case, came the emergency room. We examined the patient again and again and again. We find this reason. Actually, initially we thought about, as usual, maybe otitis media, maybe otitis colic, maybe, But actually there is something very important, حقيقة. We have to examine the infant thoroughly, everything. We found this one. You know what is this? Hair tourniquet. Very rare, but common. Alhamdulillah, we could, we release by scissor. It is, alhamdulillah, just swelling, not affected. He's okay. This is interesting case that mimicking infantile colic, mimicking, otitis media, but this is take care of this one. We need to have proper physical examination and listen to the mother, because the crying is not a typical crying of infantile colic. This is the idea. There is swelling, as we mentioned. Alhamdulillah, he's okay. Did well and discharged, and we are happy, and the family are happy. Alhamdulillah. Thank you very much. Are finished. Now, any question or proceed for your lecture, Dr. Ali? Now it is my pleasure to introduce Dr. Almuhaidib, who is the head section of Pediatric Gastroenterology, Department of Pediatrics at King Faisal Specialist Hospital and Research Center, Riyadh, Saudi Arabia. Dr. Ali, as we mentioned, maybe who's missed the first presentation, Dr. Ali is the founder of the Pediatric Gastroenterology Fellowship in Saudi Arabia. More than 30 or maybe 35 has been graduated from King Faisal Specialist Hospital and Research Center as pediatric gastroenterologist. And Dr. Ali also he's one of the founder of the SAS began, the Saudi Pediatric Gastroenterology Association or Society. Dr. Ali, most welcome. Can start your talk.
Thank you very much, Dr. Muath. I hope people are not sleepy now or they are hungry, they want to eat, but I will talk today about the role of nutrition in the infant brain development. As you could see from this picture, what is the main component of this picture? This is from our family farm, like 150 kilometers to the north of Riyadh, which we enjoy these days, with this nice, weather in Riyadh. The most important component is water. Does it have any relation to do with brain? Yes. Water is required by every cell in the body and important for all body functions. It helps transport oxygen and nutrients critical to the brain for its optimal function, and also providing cushioning and lubrication to the brain tissue. As you could see, the drinking water and the brain function are integrally linked. During fasting, people, they could feel the effect of not drinking water, as lack of water to the brain can cause numerous symptoms, including problems with focus, memory, brain fatigue, and brain fog, as well as, in older people, headaches, sleep issues, anger, depression, and many more. And if you have considered, how much of your brain is water, the answer is 80% of your brain is water. So water is extremely important. And this has, a clinical implication in infants who comes with dehydration. Just they need to be rehydrated in the appropriate manner in order to maintain their brain function. This is a slide usually I share with Dr. Muath because one of our strategic mission in the Saudi Society of Pediatric Gastroenterology, Hepatology, and Nutrition is to promote breastfeeding in our society. This is the first poll. Can we have the first poll? Exclusive breastfeeding for 6 months in Saudi Arabia is reported in what percentage? Yeah, Amir? Yes, please, thank you. 3.8%, 8.3%, 38%, or 83%. Can you answer? We'll have 20 seconds because this is an easy question. This was, presented in Dr. Muath's presentation. Can we have the result? Okay, so 38%. Unfortunately, the answer is 8.3%, which is discouraging, and we need to, work very hard in our society to improve the rate of breastfeeding in our young mothers. As was shown initially, this is a study from Asir, where only 8.3% of the school teachers who were breastfeeding, they were exclusively breastfeeding for 6 months. 8.3%. You need to remember this. in this study because it is, discouraging, and we have to work hard in order to improve this. Let us go international. The WHO has stated that exclusive breastfeeding for 6 months saves how many lives per year? Can we have the poll, please? So how many lives per year are saved all over the world as per WHO data? 82,000, 280,000, 820,000, 1,820,000. 20 seconds for the answer. You can guess. Depends on how do you believe in breastfeeding and its, importance in the life and death of these babies. So can we have both the answer, please? Okay, 820,000 versus 1,820,000. The answer is C, which is 820,000. As you could see, breastfeeding stimulates optimal initial growth, and according to the WHO, breastfeeding exclusively for 6 months saves 820,000 lives per year. It is not just disease or admission or whatever. It is lives, because these babies, as was mentioned by Dr. Muath, they die because of diarrhea, pneumonia, and other infections. Again, same pictures, and the answer to this slide is human milk is for humans, and we should encourage breastfeeding because it is the golden standard for optimal nutrition in health and disease during infancy. And these are some of the components of breast milk. You have fat for energy, brain development, and immunity. You have prebiotics, which was discussed earlier, and protein for growth and immunity, and lactose for energy, in addition to other immunological components. And if you see the composition of human milk, you see the long chain polyunsaturated fatty acid, one of the major component of breast milk, which is not is not part of the formula in long time ago, unless it was discovered and it was supplemented with formulas nowadays. This cartoon, for those who do not speak Arabic, show a healthcare provider asking a mother, what is the difference between breastfeeding and artificial feeding? And the mother answered, simple, artificial feeding, you need to pay for it, and breastfeeding is free of charge, available all the time. So I think this answer, explained to you the importance of breastfeeding, since it is available and it with all its benefits, as was mentioned earlier in Dr. Muath's presentation. Let us move to the brain now. The brain is still a mystery. Let us see, what is the brain weight at birth? The next poll. In grams, is it 200 grams, 400 grams, 600 grams, or 800 grams? Can we have the poll, Amir? What is the birth weight, brain weight at birth? 200, 400, 600, or 800 grams? Okay, can we post it? Good, 38% say 400 grams, and this is the right answer. So the brain at 20 weeks of gestation is only 100 grams. At birth, it is 400 grams. So the maximum brain growth intrauterine is in the second, in the second half of pregnancy, mainly in the 3rd trimester. And they reach adult weight around 5 to 6 years. The adult brain weight is only 1,300 to 1,400 grams. Let us see, to compare that with the infant weight. Next poll, when does infant triple their birth weight? at 6 months, 12 months, 18 months, and 24 months. Infants treble their birth weight at 6 months, 12 months, 18 months, or 24 months. Can you post the answer? "12 months, 60% answered the right answer, yes, at 12 months. What about the brain? The brain, if we say the brain is at birth is 333 grams, it reach 1 kg at 2 years of age. So it triple in 2 years. However, the maximum brain growth happens during the first 2 years. The maximum of the maximum is in the first year of life. And the human brain is the most complex 3-pound in the universe. Those who are working in the stock market, they know these numbers and the value of the numbers. 100 billion in neurons at birth, 250 to 500,000 neurons per minute during some stages of development. And they say neurons that fire together, wire together, and they function together. Next ball, the visual processing area of the brain is the frontal lobe, occipital lobe, parietal lobe, or temporal lobe. The visual processing area of the brain is the frontal lobe, occipital lobe, parietal lobe, temporal lobe. Can we post the answer? Okay, occipital lobe is the right answer. More than 50% answered the right answer. This is important. Let us see now the major areas of brain. We have the frontal lobe, occipital lobe, parietal lobe, and temporal lobe. Occipital lobe is the area for vision and perception. Parietal lobe is for sensory motor, perception, and spatial abilities. And temporal lobe for hearing, language, memory, social, emotional function. However, you should concentrate on the frontal lobe because it is very important in self-regulation, problem solving, goal setting, and social cognition. What about micronutrients? These are the date palm, farm. They have a lot of dates, which is containing a lot of micronutrients. The true matching in this poll is vitamin C is concentrated in nerve endings. Vitamin E is responsible for taste perception, and zinc is responsible for membrane protection, which is right. Can we post the answer? Oh, this is discouraging because vitamin C is concentrated in nerve ending. However, vitamin E is responsible for membrane protection, while zinc is responsible for taste perception. And that's why patients who have anorexia, secondary to malnutrition, we always supplement them with zinc in order to improve their taste perception and improve their appetite. So if it comes to the brain, many nutrients contribute. Look at this. Vitamins, vitamin B1, B12, B6, vitamin B12 for cognition and language, and iron for oxygenation and synthesis, and myelin of a neurotransmitter, and it is important for IQ development. Omega-3 polyunsaturated fatty acid for cognition and visual development, and lutein in macular protection. So these micronutrients are important, and that's why these children who have malnutrition, they suffer a lot, both physically and mentally. And brain function requires a consistent nutrient flow, including different hormones who are responsible for balanced mood, attention, endurance, appetite, and satisfaction. Which if the following is not a polyunsaturated fatty acid? Alpha linolenic acid, docosahexaenoic beta-ionic acid, and docosahexaenoic acid or ascorbic acid. Can we have the ball, please? Can we have the ball? So this is a complicated question. We'll give you maybe 25 seconds instead of 20 seconds. Okay. Okay, the answer is ascorbic acid in 58%. The other three are essential, polyunsaturated fatty acids. And the omega-3, the omegas are polyunsaturated fatty acids and differ by the bond, the place of the double bond. As you could see from this picture, this is omega-3 where the double bond is in the third position from the end of the chain. And we have these different, three main types, which is alpha linolenic acid, ALA, and EPA and DHA. It's very important for the mother health, which will contribute to the infant health. If you have a healthy mother who have a healthy diet, healthy balanced diet, and who is breastfeeding her child, then the child will be a healthy child. And the maternal nutrition is important from a long chain polyunsaturated fatty acid points. If the mother diet contains sources of healthy PUFAs in her diet, this will go through placental development and it will go to the infant intrauterine, and the fetus intrauterine will have a role in the brain and retina development. So the DHA is one of the most important omega-3 fatty acids. Like most omega-3 fats, it's linked to many health benefits, and it has a role in brain development. And you need, body cannot produce it in adequate amount, so you need to obtain it from the diet. It's mainly found in seafood, such as fish and fish oil, in some types of algae, طحالب باللغة العربية, and this is the source of, L-PUFA in infant formula. And in fact, DHA comprise over 90% of omega-3 fatty acids in the brain and 25% of all the fat content. And we know that omega-3 and omega-6 are important for brain and visual development, and it has a more influential effect on behavior and mood in these children. In this meta-analysis, almost 13,000 participants in 34 studies, they concluded that omega-3 PUFA supplements significantly improve cognitive development in infants, but do not improve cognitive performance in children, adults, and the elderly. And omega-3 PUFA intake, especially that of DHA supplements, may benefit cognitive development during infancy. And this, graph show you how rapid is the deposition of DHA in the brain as compared to other fatty acids. So nutrients affect both the structure and the function of the nervous system during critical period of development, both at the macrostructure level in the cerebellum, hippocampus, frontal lobes, or microstructure level at growth cones, dendrites, and synapses, or at the transmission speed, which is very important in the development of these infants through myelination and neurotransmitter. If you consider the brain development, as I mentioned earlier, the rapid brain growth is between 20th week gestation and 2 years. And brain size increases by 64% at 3 months, which is extremely important. So nutrition is crucial to the initial development of the central nervous system and then to its maintenance. LC-BUFA constitutes 7.2% of fat in the cortex and 15% in the frontal cortex, which is important for cognitive function. And it has a role in the neuronal membrane structure and fluidity, number of neurotransmitter receptors, and the production of neurotransmitter and brain peptide and neurotransmission speed. This is just to remind you that the frontal lobe is important in self-regulation, problem solving, goal setting, and social cognition. Learning and cognition depend on a large amount of DHA accumulating in the brain during the critical period of development. And there are potential long-standing effects of LC-BUFA on learning and cognition beyond the critical period of development. How do we measure the cognitive development? There are people who are specialized in this aspect, but we'll go through this quickly. We have the intelligent quotient, cell IQ. This will measure the intelligence and abstract cognitive function in children aged 3 years and more. However, in younger children than 3 years, we use a developmental quotient, which is called DQ. And IQ and DQ scores are derived from standardized tests, indicate the developmental level of a child in comparison to average children of the same age, and show a range of scores based on the normal distribution. As you could see, both IQ and DQ scoring between 85 and 115 is the normal range, and it is seen in 68% in the normal population. So one of the tests we used to know is the Bailey scale of infant development, which assists the mental development index, psychomotor development index, cognitive scale, language scale, and motor scale. And there is, Bailey 4, which was released early 2020. The other type of scale is the Fixler Preschool Primary Intelligence Scale, which has, a standardized test for intelligence in young children and available in many languages. And it has 14 subset. We don't want to go through all of this for the sake of time, but it will have, measure the verbal IQ, performance IQ, full scale IQ, and processing speed quotient. And these are the specific tests for cognitive development. This is a very important slide for every pediatrician, which is the major milestone in infant development with the different areas, cognitive, motor, social, and communication. And, between 3 and 6 months, they start to have the focus, attention, which is very important in this, age for their development. So between 3 and 6, the 3 phases of attention are orientation, where you have engaged attention, and then sustained attention, which is the learning, which is the important, and then termination. And, some people, they may see themselves, imagine their self as different. Maybe some of these people, they did not, take LC-BUFA when were their infants. Let us see the difference between heart rate and attention, the relation between heart rate and attention. Heart rate defines sustained attention, as you could see from this graph, is a well-validated biological measure of attentional engagement that in non-clinical infant population provides incremental information about attentional engagement beyond looking behavior alone. So this is the test which was used to differentiate between different type of infants. they start engagement, and if they concentrate, which is called sustained concentration attention, their heart rate will decelerate. And then once they lose, disengage attention, the heart rate will go to its baseline. And the K measure is the percentage of looking time spent in sustained attention. Some infants maintain high level of sustained attention across the first year of life. And these infants perform better on tests of language and cognition at 3 to 4 years. What about, cognition in 8 to 9 months? Object permanence, where they find a hidden toy. So they watch a toy under a cover, then they remove the cover and retrieve the toy. Success requires memory and problem-solving abilities. And then we have the two-step problem solving, where the problem involves 2 steps to retrieve the toy. And it has been found that LC-PUFA improves success at problem solving. At 12 months, stimulating development is very important. And the American Academy of Pediatrics recommend reading to infants. And this effect will persist into childhood and become stronger the later the language tests are conducted. And pointing to pictures and naming them is recommended for infants at this age. So what is the scientific evidence that LC-PUFA in early infancy improve visual and cognitive development? In many different areas, which is mentioned in this slide. For the sake of time, we will go to the next slide. As you could see, testing visual acuity in infants is very difficult. We have 2 types of tests: the Teller acuity cards and visual evoked potential test. The Teller acuity card procedure provides a quantitative measure of grading acuity in infants and young children and has been used in clinical and laboratory settings. The purpose of this test is to differentiate between infants who can see and who cannot see. The acuity improves rapidly from birth to 4 months, as in this picture, and continues until adult-like levels are reached at 5 years. And LC-PUFA, especially DHA, produce more rapid acuity development. Let us test your acuity, visual acuity. What do you see in this picture? In this picture, if you see it, you think this is an old man, maybe like myself after 20 years with this white beard. However, if you concentrate well and if you have enough LC-PUFAs, then you will see different things in this picture. You will see a horse, a man, somebody lying on the floor. You have a river and you have a gate. So visual acuity is very important test in infancy, and it is related to the amount of DHA taken by these infants. And effect of DHA and ARA supplements in this study by Ahmed Qawasmi, which was published in Pediatrics 2013, has shown that LC-PUFA supplementation of infant formulas improve infants' visual acuity up to 12 months of age. They have used visual evoked potential at age of 2 months between infants in different groups. So infants who received DHA and ARA and showed poorer attention control at 3 months solved more 2-step problems 9 months than the control group. And 2 separate randomized control trials showed that infants fed the formula with DHA and ARA had better 2-step problem solving at 9 months compared to the control group. Infants fed the formula with DHA, ARA solved more 3-step problem at 10 months than the control group. And this is the complex, 3-step problem where, the infant will remove the block first, then will pull the cloth, and then will lift the cover and find the toy. LC-PUFAs improved 3-step problem solving, and poorer problem solving in the control group was observed. So global tests such as Bailey scale usually fail to detect differences between LC-BUFA supplemented and control group, but any difference always favor the LC-BUFA groups in these different studies. And Macrides have documented that DHA decreased the number of term infants with delayed development through this study, which involves 726 women with a placebo group. And Colombo have published a diamond study where they randomized infants to 4 groups. First group is the control where there was no supplements, and the other groups with 0.64% of ARA and different percentage of DHA, and they measured visual attention at 4, 6, 9 months and heart rate measure to identify phase of attention. And as you could see from this table, that LC-BUFA increased duration of sustained attention, especially with 0.64% DHA and 0.3% DHA. So children aged 6 years supplemented with DHA and RA in infancy were more efficient at solving problems. And in this diamond study, children followed up to 18 months and 6 years compared to the control group. The LC-BUFA group had better scores on attention control, receptive vocabulary, and Whistler, full scale and Whistler verbal IQ. Also, they use the dimensional change card sort, which is a standard procedure for assessing executive functioning early in the development. And in the task, participants sort bivalent cards. Example, red truck one way, example by color, and then are instructed to switch and sort the same card in a new way, i.e. by shape. And this is what they do first, by shape game, and then by color game. So children with poorer attention control make errors after the rule change, which is very clear way of testing the cognition of these children. So also it has shown that through the dimensional change card sort, those who have been supplemented with 0.64% DHA and 0.3% DHA has done better than the control. Also, it has been shown to affect communication and gesture. They have a study where they supplemented infants with liquid fish oil compared to a placebo, and the fish oil group produced significantly more gestures. Also in language, the same thing, infants were supplemented with liquid DHA or placebo, and DHA infants produced their first word 3 weeks earlier than control infants. This is a picture from the desert of Saudi Arabia, from Tabuk during winter a few years back, and I think the most important component of this picture is this camel. Do you think camel milk has LC-BUFA as compared to other milk? The answer is yes. I have reviewed multiple literatures from Sudan and from Sudanese universities where they have documented a good percentage of LC-BUFAs in camel milk. This is a recent publication in January 2020. Should formula for infants provide arachidonic acid along with DHA? A position paper of the European Academy of Pediatrics and the Child Health Foundation. As you know, the European Union have regulatory standard from February 2020 onwards. All such product marketed in the European Union must contain 20 to 50 milligram omega-3 DHA per 100 kilocalorie, which is equivalent to about 0.5 to 1% of fatty acids, and thus higher than typically found in human milk and the current infant formula products. So the available evidence strongly support the benefits of adding DHA and ARA to the infant formula, and DHA should continue in children's diet beyond the 2nd year of life. DHA must be deposited in adequate amounts in brain and other tissues during fetal and early postnatal life. And pregnant and lactating women should aim to achieve a dietary DHA intake of at least 200 milligrams per day. So in main conclusion, achievement of cognitive, social, motor, and communication milestones can be checked during the 1st year of life. and opened on development of the brain. And LC-PUFAs plays a fundamental role in brain development and function. And randomized controlled trials show positive effect of LC-PUFAs, especially DHA, in development in infants. New data indicate the long-term benefits of early LC-PUFA supplementation for cognition in later childhood, and optimal nutrition in both mothers and infants promotes optimal brain and cognitive development. And this is one of the children who has, good attention, and maybe he has received LC-PUFAs. By this, I will end the presentation. Thank you very much and stay safe.
Thank you, Dr. Ali, for this comprehensive presentation and informative. We have some questions here. Where is it? There is one question, Dr. Ali. Is there any link between infant nutrition and development of ADHD?
In reality, if you review the literature, the LC-PUFA was measured in patients with ADHD and was to be very low, and it was concluded that maybe this is one of the causes of the development of ADHD. As LC-PUFA is very important not only on infant and fetal and infant brain development. However, it is important to prevent against cardiovascular accident in adults, against Alzheimer's disease, and against also attention deficit hyperactivity disorders. And, most of the time, these patients have low levels of, in their RBCs of, LC-PUFAs.
There is a question, Dr. Ali, regarding can we have breast milk bank? Mothers can give the other lady.
No, this is, the breast milk bank, this is something legal, and it should come from the government. However, to my knowledge, this is not possible in the Kingdom of Saudi Arabia, since we have the, what do you call it, al-akhwan min al-rida'a. They are brothers in breastfeeding or so. However, in the past, there were a lot of mothers who were, donating breast through active breastfeeding, babies for sick mothers or mothers who died in their society. And nowadays, because of the development of the infant formulas, this practice has been, less and less nowadays.
Thank you very much, Dr. Ali. I would like to thank all our colleagues, all our attendees for this webinar. Just some question regarding the CMEs hours. You have to answer the survey, and after that, you will get the CMEs hours. And we also request for all the healthcare providers to be eligible to get the CMEs hours, because some questions are the nurses eligible? Yes, we ask from the Saudi Commission to get that one, but there's some regulations. We have to respect the regulations of the Saudi Commission. Anyway, please answer the survey, and we can upload your CMEs hours. It is accredited as 3 CMEs hours. Thank you very much.
Thank you, and I will hope to see you in the next webinar soon.
Survey must be sent to all attendees on their emails shortly. Thank you.